In this presentation, we're going to discuss diseases of the kidney, specifically acute glomerulonephritis. During this presentation, the learning points that are discussed will be the pathophysiology of the disease, transmission and causes of the disease, three major nursing diagnoses, the interventions for these nursing diagnoses, a treatment plan, and nursing care impact on outcomes. The pathophysiology of this disease. Immune response leads to inflammation and damage of the glomeruli. The glomerulus acts as a filter to remove waste and excess water from the blood. Increased permeability of glomerular membrane leads to hematuria, proteinuria, and reduced glomerular filtration rate. Sodium and water retention results in edema and hypertension. Causes and transmission. Most commonly follows a strep infection. So if someone has a streptococcal infection, they're more prone to having this particular disease of the kidney. Other causes are viral infections and autoimmune diseases such as lupus and bacterial endocarditis. Not directly contagious, but underlying infections can be. Important nursing diagnoses are fluid volume access related to sodium and water retention, risk for impaired skin integrity related to edema and immobility, risk for infection related to immunosuppressive therapy, and compromised immunity. Important interventions. Monitor intake and output and daily weights. So you would want to monitor the weights of this patient daily on the same scale every day. Restrict sodium and fluid intake as prescribed. You would want to follow a strict intake um, for this particular disease, especially as follows for the kidneys. Administer diuretics and monitor response. You would want to administer diuretics so that the patient is not holding on to fluids. Reposition your patient every 2 hours to keep them from developing bed sores. Elevate the edematous limbs. Assess the skin regularly for breakdown or ulcers, which also goes with repositioning your patient. Use strict aseptic technique for all procedures because they may be immunocompromised due to the therapy that they are receiving. Monitor for signs of infection such as fever, white blood cell count. Educate patient on hand hygiene and avoiding crowds, especially with steroid use. The treatment plan would be antibiotics for any underlying infections, if bacterial, of course, corticosteroids, immunosuppressants for autoimmune causes, which is why you would advise them to stay away from crowds, and you will make sure you implicate proper hand hygiene and clean aseptic techniques. Antihypertensives to control blood pressure, because the kidneys are in charge of that. Diuretics to manage fluid overload, dietary modifications, low sodium, and adequate protein. Nursing care impact on outcomes. Early detection and intervention can prevent chronic kidney disease. Supportive care improves quality of life and promotes healing. Education and ongoing assessment reduces complications. Discussion questions for my classmates. Why is it important to monitor a patient with acute glomerulonephritis for changes in urinary output and blood pressure? How can nurses help patients and families understand dietary restrictions and their role in recovery? Thank you.